guest today is one of the great spiritual masters of our time. Applauded, celebrated, awarded the Nobel Prize. One of India's great national inspiration. I'm delighted to welcome. Hello and welcome to my series of conversations with men and women whose ideas, vision and philosophy help define our contemporary world. My guest today has made a unique and remarkable contribution to the lives of hundreds, perhaps thousands of people in India, victims of cancer. And even as I use the word victims, I think her effort and her work has been to take the discourse on people afflicted with cancer beyond their treatment merely as victims. I'm delighted to welcome Harmala Gupta. Harmala, you are president of a remarkable initiative, CanSupport, and this was born out of your own, how do I put it, converting what is ordinarily seen as a traumatic, defeating event in one's life, to be diagnosed with cancer, into something that became more than that for you, became a journey in helping other people, in moving beyond yourself, my disease, my condition, to looking at the predicaments of other people. India has more than 2.5 million cancer patients at any time who are being treated for cancer so that they can just keep living in a sense. But what you offer and your work offers is looking at palliative care. Perhaps we could begin this conversation with a brief description of what is palliative care as opposed to just treating the condition of a disease.
Right. Well, I think palliative care is really treating the person and the human being in all their varied aspects, which, as we are aware, goes far beyond the physical. There's the mental, there's the emotional, there's the spiritual, there are the ties with those around you. So it's really concentrating on the needs of that person, and therefore the care we give is given through a team, because no one person can supply all these needs or is trained to do so. So there's a doctor on the team, there's a nurse on the team, there's a counselor on the team, if necessary, there's a spiritual counselor on the team, and I would say even the patient and the family are part of the team, because I think it's important for people also to define and to set the pace at this time of their lives, and to involve the families, because often the families are the primary caregivers and are as much affected as the person who is going through this life-limiting experience.
What you're doing is offering a very valuable one-on-one, more or less, intervention, reaching out to individual patients. And simultaneous to your work with CanSupport, you have also been looking at the public health dimension of this, aspects of policy decisions, which such as the easy availability of morphine and its role in alleviating pain, but looking at the public health dimension, which is the sort of the magnitude of the problem, and our ability and the structures and processes that we might develop in order to address those. I mean, there can only be that many Harmalas and that many organizations. So in a city like Delhi, you are able to uniquely, look at 500-600 patients, 2 or 3 people a day, in a sense, in terms of numbers. But given the fact that there are that many million, 2.5, 3 million people with cancer in India, what are some of the initiatives, the measures, the processes that we could initiate to address this at that scale?
Well, first of all, let me say that palliative care is not a super specialty or very sophisticated care. It's care that can be taught to nurses, can be taught to ordinary nursing aides and assistants. You can teach the family how to care for this person with backup and support from a doctor who is not a specialist but is a general practitioner. So it's not expensive care. It's care that can be very well integrated with our public health system, because when we talk of palliative care, we're not tying it to any one condition like cancer. It's care that's available to anyone who is facing a chronic, life-limiting and life-threatening condition. So it could be even with someone who is suffering from heart failure, someone who has geriatric problems, or neurodegenerative problems. So I mean, there's a whole huge community out there, and this care can, I believe, very easily be integrated with the health system, with the public health system, with very little training. And we are willing to give that training because we have the benefit of having done this for 10 and more years now. And as I said, it can be available at the district level, at the panchayat level, and as we do at the level of the home. So it's something that is you don't have to spend a lot of money on, and yet it can make such a difference to the quality of lives of people. And I think that's really what I would like to emphasize.
What are some of the sort of the inhibitors or the factors that are resisting the growth and the evolution of this kind of approach to medicine? It seems to me from the outside that it has much to do with the assumption of Western medicine that we need to keep a patient alive at any cost, no matter what the consequences for the patient, and a philosophy and approach to medicine that it incorporates. Obviously, the pharmaceutical industry has a vested interest in that kind of approach to medicine. So what are the kind of obstacles or resistance that comes up in your efforts to what seems a very natural, obvious thing for people to take up and do?
Well, I think, Rajiv, you have identified a couple of them. One is, of course, the very strong pharmaceutical lobby, the fact that Western medicine does stress on the need to cure, and if you are unable to do that, you are a failure, and that every death almost is an unnatural act and not really seen as something that's natural. And I would add to that the privatization of medicine, sadly, that's taking place in our country, where almost 80% of our medical facilities today are in private hands, and the motivating force there is always profits. And I believe that hospitals make the maximum money from their ICUs, and therefore there is a very strong compulsion to put people in those ICUs at the end of life. As well as keep on giving them more and more sophisticated care. And I think the other side of it is that we need to counsel people, explain to people, have those conversations that allow people to make decisions and decide what works well for them or their loved one. And our failure to do so often leads to this fear in people that unless this person is in a super specialty or an ICU, they won't be able to cope. And so there again, I feel it's sharing that information, making it more widely available, and allowing people to have that sense of control over their lives and over the way that they would like to face it towards the end, giving them back that dignity, which I think is so important.
People describe those that have survived cancer as cancer survivors, and I always feel that that's not a how do I put it? It's not a sort of positive, empowering enough way of looking at it, because people like you don't just sort of survive cancer. It enables a process of enormous growth, of insight, of something far more positive than just surviving a disease. So in what ways do you feel that your experience of cancer changed you, and what impact did it have on you?
I think that it had an amazing impact on me, and I feel that it's an impact that never really stops. You're constantly growing, but it certainly got me to think about what was important in my life. And I had to answer that question of who I was and where I wanted to be in the future. And I think that that's it's a defining moment. And in many ways, I'm fortunate to have had that experience along with others who often face these crises. And I think that teaches you that you learn to take every day one at a time. You learn to live without having the need to always control. And I think you just realize that sometimes you cannot control, and it's not such a bad thing after all. And I feel that other side of you, that spiritual side of you, if you'd like to call it, or the side that connects you to something much larger than yourself. I think it's so liberating, because then it's not just you, little you, it's something so much larger, and you can really bask in that in that larger sense of being and existence. And I think to that extent it's a very positive experience, and you'd be amazed when we speak to cancer survivors and we sit together, and each one of us says exactly the same thing, that we have gained so much in terms of our own personal growth from this experience. I just wish we could have been wiser without it, but sometimes I guess we need a little shake, and this was the shake in my life. And I'm very grateful for the opportunity to be able to use that experience in a positive way to assist others.
You're watching the conversation with Harmala Gupta, President of CanSupport. We'll be right back after a short break. Don't go away.
ये बंदा क्यों है ठंडा?
अपने सर पर योगी राज का हाथ है। अब सिर दर्द, टेंशन, थकान की बंद कर दो दुकान।
14 जड़ी बूटियों का वरदान योगीराज आयुर्वेदिक ठंडा तेल। हर बंदा झट से ठंडा। वैस्मॉल योगीराज ठंडा तेल।
ये है लाला धनी राम जी, बेईमानी में बड़े नाम जी। माल तोलते वजन घटाकर करे मिलावट आंख चुराकर।
ऐसे धोखेबाजों को सबक सिखाओ। ना सुने आपकी तो मामूली फी देकर कंज्यूमर फोरम में शिकायत दर्ज कराओ। जागो ग्राहक, जागो।
नया सवेरा, अपने अधिकार को जानो।
कोई भी दुकानदार कुछ भी बेचता हो, अगर आपको शिकायत हो तो कंज्यूमर फोरम में शिकायत दर्ज कराएं।
Welcome back to a continuing conversation with Harmala Gupta, President of CanSupport and a cancer survivor. I just said that I wasn't very happy with the description.
I don't know what other
of
word we
cancer
can use,
survivor,
really.
We'll have to think of something.
Yeah.
You said that it had given you, an understanding of who you were, where you were, and what you wanted to do. So what were those insights? Apart from, of course, the largest swell of things that you've spoken about, a sense of the diminishing of the self, a surrender to the larger, a larger universe perhaps. But what did you discover about yourself?
Well, I think I discovered just how much I needed to change, and that I was on a path that really had me angry, flustered all the time, and it was doing me no good, and not helping my relationships either. So I think that was something that immediately came home. Plus the fact, I think it taught me that the secret to life, I feel, is really reaching out beyond yourself to another person. Sometimes that can be the best thing you can do for yourself. And I remember even when I was sick, I had such a need to feel that I could be of some use to someone else. And there was this lady next to me, and she needed these ice packs continually, and the nurses weren't able to give them to her. So just the fact that I could get up, go to the refrigerator, take that ice pack and give it to her and make her feel better, did enormous good for me, more than any of the medicines that were being given to me. And I think that just taught me that by reaching out to someone else, we do ourselves the greatest favor, and we have an opportunity. All we need is ourselves. That's all. We don't need anything beyond that. We just need the desire to help someone, and anyone can do it.
Lead us through both your personal experience and the experience of the hundreds of people that you support and help through your palliative care program, so that in a sense our viewers and all of us can learn from it, and maybe we can look at some of the lessons that come up. So perhaps we just start with the with the diagnosis that a doctor tells you that you have cancer and you have not very long to live. It's terminal. And what are the questions? What are the the issues that come up? As a person, who's had family and friends with cancer too, it is first the question is fear. Bang, the world crumbles. So give us a sense of what happens when that first sort of word, the C word.
Right. Well, there's tremendous shock, of course, and then you feel there's a mistake. It can't be. That's impossible. How could it be? So there's denial. And then there's that question of why me? What have I done to deserve this? Which often comes out in the form of a great deal of anger and resentment. And then self-pity, poor me, I didn't deserve this. And then, of course, bargaining. I'm going to change my life from now on. I'm going to be good, So whoever you are out there, this power, please help me. And then, of course, slowly acceptance. And I think that really is the turning point, the day you accept.
What do you say to people who are going through these processes? What did you say to yourself?
Well, I told myself, I said, don't consider cancer an enemy. Maybe it's come in your life to teach you something. Try and understand what it's trying to teach you. Now is a time to really learn. That's how I saw it. And so I said, all right, you're part of me. You're a cell in my body. And I don't reject you. I accept you. And now please teach me. And I really felt it was an opportunity for me also to discover my limits. So it was a challenge in that sense as well, a personal challenge, that in the face of this adversity, how would I shape up? I was given a chance to sort of discover that. And so I think, again, it's that ability, I think, which is available to each one of us. I don't think there's anything unique at all about me, to really use this as an opportunity for positive growth. And I think that is available to us through anything, and letting go of the final outcome. I remember I was obsessed in the beginning. I wanted to know, will I get well? Will I survive? And no one could give me that guarantee. And I realized that was leading me nowhere. Because then all the fear, all the dread, everything I lived through it again and again. The moment I was able to say, really, that doesn't matter anymore. I was never in control anyway of the final outcome. But you know what I do have control over is today. And I have control over the way I want to face it. And I have control over the way I want to now communicate with those around me. Let me concentrate on that. And I found that completely changed it for me, and possibly even changed the outcome, who knows.
In a sense, what you're saying is also true whether you have cancer or not. That, we really don't know what the outcome or, what's going to happen at the end of the day. I mean, we could be dead. It could happen to anyone at any time. Okay, so we've reached the stage of acceptance, and then there is treatment. So what is the relationship with the treatment? And the treatment, the process of treatment is unpleasant, certainly in terms of Western medicine, and the choices of treatment. So what happened to you, and what typically happens to people when they go through this process, and how might they look at it? How might they approach it? What might they see that you saw and are not seeing?
Well, unfortunately with cancer, the treatments are highly toxic, and they're not over soon. And you end up feeling much worse than when you began the treatment. So you need a great deal of motivation to continue with them, and I think a lot of reassurance. And this is where I feel that all those who you come in touch with, the medical professionals, the nurses, need lessons in communication. They need to know how to communicate with you, how to support you. They should be able to reassure you when you need that, able to ready to answer the smallest question you may have. You need good information that you as a patient, as a layperson, can understand. And I think this to a large extent can take care of your fears, because there are times when you feel as if you're not going to make it, and there again, it's the mind plays tricks with you when your body is weak and going through that. I realized how my mind was really making a monkey out of me, And that's the challenge, to keep your mind under control, to be able to control it. And that's the level at which you have to work. And I think it's helpful if you also are in an environment, both at home and in the hospital, which is supporting you, where someone is ready to answer all your questions rather than dismissing them as of no use.
How important here is honesty? Because very often our notion of support is either to pretend to the patient or to our loved one that there isn't a problem, or to sort of diminish the possibilities, or not talk about the possibilities that, look, the treatment may not work, because you sort of feel that is what the person who has cancer or a terminal condition wants to hear or needs to hear. So motivation sometimes can mean encouragement. You're going to be fine, even though, perhaps logic or medical science tells you no, you're not. Whatever fine is.
Well, it was very interesting because I was in Canada doing a PhD when I was diagnosed, and the attitude there was that you told the patient everything. They had a right to know. So I was being given information which I feel in some ways I wasn't quite ready to receive, and I just felt, no, don't tell me so much. I don't want to know so much. I don't think I can take it in right now, But in hindsight, I realized that what they were trying to do was really make me responsible also for my treatment, and make me realize that it wasn't something where the doctor would come and do it all for me, but it was something where I also had to play a role, and I had to be made ready, and I had to understand that responsibility. And it was a responsibility I was not willing to take up initially. But having said that, I will say that how much you should tell a patient and how you should tell them, when you should tell them, I think are important questions as much as what you should tell them. And this will differ from person to person because we are all very unique. But I do believe that there must be basic honesty. If someone asks you outright, please do not lie to them. Because if I cannot trust my doctor or those around me, I think it just adds to that burden that I'm already carrying. So I'm all for honesty, but I think it should be done gently. It should be done keeping in mind how much I want to know, and understanding that there will come a time perhaps when I will be more ready for more information, and at that time to be provided that information that I need so that I can make an informed decision. As I said, it's a difficult treatment, it's a long treatment, and if I'm not totally in the picture, I cannot understand what is happening to me, and I'm likely to either give up or I'm likely to lash out at those close to me, and I don't think that's helpful in terms of my own healing and recovery.
You're watching a conversation with Harmala Gupta, President of CanSupport, an initiative that looks after, that explores, that furthers the agendas of palliative care in India. We'll be right back after a short break. Don't go away.
आपने हाथ धोए? क्या आपने हाथ धोए? खाना पकाने और खाना खाने से पहले साबुन से अच्छी तरह हाथ धोएं। एक बात और, पीने के पानी में गंदे मैले हाथ ना डालें। डंडीदार लोटा इस्तेमाल करें।
Welcome back to a continuing conversation with Harmala Gupta, who triumphed over cancer and has reached out to hundreds and thousands of people who have been in her kind of predicament. So we were talking about the stages and the processes and trying to understand that better. So we now have this condition, perhaps, that it's a terminal condition. It's clear that at least to some sort of a benign, how do I put it, physician who isn't driven by commercial motives, doesn't want to continue treatment because he wants to keep a hospital bed occupied and to keep getting the patient to spend money, that this is terminal. and the patient knows that, look, this is it, and it's going to be X number of weeks, months, or whatever. Then how do you begin to look at life and sort of the grace of the divine or the supernatural or whatever, or the universe perhaps, if we don't believe in a God, that you didn't have to confront that Rubicon, but the people that you're working with do. What do you do then? What is the person who now confronts it? How do they look at it? And as someone who's helping them, what are the things that you do and say?
Well, we appreciate that it's a very painful period in people's lives, because it's going into the unknown. It's cutting your ties with everything that you have known till now. It means maybe even having to sacrifice your dreams of the future. So there's a lot of pain that people carry, having to face the end. And what we try and do is help them, make them comfortable so that they can share some of these fears with us and talk about them. We don't pretend to have any answers for them, but I think just making people comfortable enough to talk about these things helps, to help them sort it out for themselves, because I believe each one of us has to undergo this journey ourselves. We have to go and inside ourselves understand what we are about, and often for people I find it's the beginning of discovery, self-discovery, something that they never did before, and they suddenly find, my gosh, here's an opportunity to do things perhaps that I wanted to do as well, to say things that I wanted to say and never had the time to say. So it can be also very liberating for people, and I think that life has a certain intensity in the face of death. I remember even personally, I felt even the colors around me in nature were much more intense. So you live with a heightened awareness every minute after that, and I think that it can be a really an opportunity for you also to have a good closure, something that's not given to everyone. Often, death can visit you so suddenly that you have no time for preparation, but here you have the time for preparation.
What about the processes that caregivers and families go through?
Well, it's very painful for family, which is often when we go into homes, they tell us, don't discuss the diagnosis, don't talk to this person. And of course, when we are there, the only thing the person wants to talk about is their diagnosis and what the future holds for them, and they realize that their bodies are not holding out. So it's a process again of understanding why the family is doing this. They again are carrying their own pain which they can't face. So it's getting them to understand what is in the best interest of their loved one now, getting them at this very important time to come together to talk about the past and to celebrate this life, this wonderful life, this unique life. Often we tell people, sit down, look at the photographs, look at your albums, remember those good times when you all laughed and what you did and this and that. And it can be such a wonderful opportunity to even come closer to each other. And I think that we want to help families and assist them with that, so that the passing of this person can be beautiful, because really dying can be very beautiful. Our home care teams testify to that again and again. How people, if they have done the things they wanted to do, leave practically with a smile and a radiance around them. I remember one of our doctors coming one day and saying, I think I looked on the face of the divine today. And I said, yes. She said, yes, this patient was aglow. And she said, he's never done this before. He came to the gate and he waved to us. And I knew we weren't going to see him again. So it can be just an incredible moment. And I think all of us who do this work feel so privileged to be there at this time. Much like I imagine a midwife or a gynecologist at the time of birth, because this is almost a period of transition and a time of birth, I feel, to something which will always remain a mystery, but which need not be terrifying and frightening.
So thank you very much.
Well,
It's been
thank you,
quite
Rajiv.
wonderful and a great learning experience for all of us.
Well, I've enjoyed it thoroughly, and thank you for giving me this opportunity.